All right, I'll take a start. I'll take a stab at the USPSTF. So, I think that it's a huge mistake, and I think we're seeing already the mortality for prostate cancer is going up. And I think part of the problem is shared by the providers, by us, because in the past, we've probably have been too aggressive at treating too many people who have cancers that are low risk and not likely to cause harm. So the broader medical community has responded by trying to limit our ability to detect prostate cancer. Whereas I think a smarter approach would be, we need to find out, or we should find out, who has prostate cancer, characterize the prostate cancer, be aggressive where we need to be aggressive, but then we need to back off when we don't need to be aggressive. And that way, to more carefully personalized treatment. So it's not like every time there's prostate cancer, you have to do a certain kind of treatment. And if we as a group of professionals can be more thoughtful, us here on this stage here and all around the country and all around the world, then we can, as some people have said, we can sort of disconnect the diagnosis from the treatment and think about them separately. And if we're able to do that, then it does make logical sense for us to be able to try to go out and try to detect prostate cancer and just not have this sort of automatic response that you have to do treatment for everybody.
I agree with you, Dr. Cher. It was a big miss by the U.S. Preventive Task Force to make this recommendation. It's the U.S. Preventive Task Force, I won't go into it, it was a very small arm of the government that got very powerful. The people involved with this decision, none of them were urologists, none of them were oncologists. They were family medicine doctors, and a couple different law changes and things that went on made them very powerful with not a lot of experience. And when this came out in 2012, this was huge and sent shockwaves through the urological community. And most urologists disagree with this. And they disagree with this because when you look at the data, PSA saves lives, okay? Everywhere where we have PSA screening, the death rate of prostate cancer goes down, the metastatic rate goes down. But what Dr. Cher was alluding to is what we, and this is the good part of the U.S. Preventive Task Force recommendation, is we have to do a better job of who we treat, who we biopsy, who needs surgery, who needs radiation, and who we can watch. And what that has allowed us to do, and a lot of private industry has gotten involved with this, is we have a lot of new biomarkers. Biomarkers are blood tests, urine tests, or tissue tests that can better identify who needs surgery, who we can sit on, and who we can watch. It's also, we've seen an explosion in new blood tests that go beyond the standard PSA that will tell us if they have abnormal PSA, what's the likelihood they have a cancer that needs to be treated. So that's an intermediate or high-grade cancer. So those are the cancers, or those are the guys we should biopsy. So even though this was a big negative, and like Dr. Cher alluded to, we're seeing more metastatic disease, more deaths from prostate cancer, and that's going to be the unfortunate outcome. At the same time, as the urological community has gotten their arms around this, we are developing new technologies, new blood tests, and focusing our studies and efforts on treating patients who need to be treated.